This was a Black female identified client that I work with. This was a client in her 30s. She used she as her pronouns. And she came to me quite depressed and anxious. And she didn't know what to do. She had tried therapy before, a lot of self-help stuff, and nothing seemed to work. And one particular session that I remember very early on was that she had visited with her primary care physician and had been prescribed an SSRI, a depression medication, because she was feeling depressed. And so what we did in that particular session is that we named that depression, but that we put it in context. We named it in the context of what she was experiencing in her life, and specifically at work. This is a client that had been fighting pretty much with her work, some workers and also some higher ups at her agency, and really naming at work, using her voice to try to bring about change because of things that were happening around race in her workplace. And what happened to her was that there was a lot of micro and macro aggressions that she was experiencing there. This is a client that had experienced racial-based trauma in her life, and here was something in her present that was happening. And so we name the depression in the context of racialized trauma, that it was not just something that was happening with her as a deficit and that she had to fix as take medications, but rather that was intrinsic to the contextual factors that were happening at work, that had happened in her larger life in her past. And guess what? This was a client that I saw recently, and that was also very affected by the rise of white supremacy that we have seen in this country. And that was very significant to her, because she began to see her depression as part of something larger, not a deficit, but actually as an effect, as an impact of things that were happening around her. And so then the next step that we began to do with her was ways that she could take care of herself. And this all goes with, the 3 phases of treatment, right? Resourcing, stabilization. And she began to take very, very small steps. She decided not to take the medication, and she worked on very, very small steps that she could do to empower herself. Not only in the world, but also in her family, because there were a lot of things happening in her family, and most certainly at work. Then we began to identify, what are the touchstone events? What are the things that happened to her in her past that created the conditions for her to experience what she's experiencing now, this re-traumatization. Some of them we just trace from her present to the past, what in EMDR you would call a float back. But then also we began to work with those events through a more trauma processing lens. And what happened eventually, which was quite fascinating, was that this client decided to leave her job and to create her own organization, because she was no longer identified as a victim of her circumstances, but rather she began to identify with a sense of empowerment and her own capacity and her own strength to make her own choices in life.